Hello everyone, this is Dr. Mansoodin Rao and the program I teach medical students. Topic of the today's lesson is cerebral palsy. What is cerebral palsy? Cerebral palsy is the group of motor disabilities related to the movement, balance, and the posture. This is due to the injury to the developing brain, which may occur before delivery, during delivery, or after delivery. We are going to touch this topic with regard to the etiology, clinical presentation, and a brief note on treatment. Cerebral palsy, as I told you, is a group of permanent motor disabilities related to posture, movement, and the balance. There could be associated visual and auditory disturbances, sometimes complicated by seizures, intellectual impairment, and feeding problems, recurrent infections, okay, bone deformities, etc. Sometimes the patient may suffer from urinary incontinence, etc. The brain injury is what we call non-progressive, and the disability is permanent. Okay, as such, there is no cure to cerebral palsy, and patients may improve some degree of functional disability could be improved with adequate supportive care and some drug therapy. Well, coming to the etiology, it could be genetic and chromosome anomalies, mutations of the genes that control the development of the brain may result in cerebral palsy. Okay, and trauma, what could be mechanical or metabolic, like hypoglycemia or hyperbilirubinemia, can cause the injury to the developing brain. Prolonged perinatal asphyxia could be traumatic. Maternal infections, maternal eclampsia, maternal hypertension, maternal diabetes could also be some of the risk factors. Prematurity as such is a single risk factor for cerebral palsy. Okay. The developing brain of the premature babies is more susceptible to injury, either hypoxic or metabolic. Preterm babies, there is a higher incidence of congenital anomalies, which may also be responsible for cerebral palsy. Vascular lesions, if they're associated with the thrombophilias, there could be thromboembolic phenomena resulting in ischemic injury to the developing brain. These are some of the etiological factors for cerebral palsy. There are several factors which the list of which includes, there is a big list of etiological factors that may cause the injury to the developing brain. Not all the risk factors result in the cerebral palsy. Okay. Well, coming to the clinical presentation, there are 4 important clinical types of cerebral palsy that have been described. That is, one is spastic, number 2, dyskinetic, number 3, ataxic, and the 4 is mixed. Spastic cerebral palsy is the most common, accounting for nearly 80 to 90% of the patients with cerebral palsy. It is again subdivided into hemiplegic type, diplegic type, and quadriplegia. Coming to spastic hemiplegia, there is a weakness of one half of the body due to the lesion related to thromboembolic phenomena. Okay. There is hemiplegia and hemianesthesia in one half of the body that is contralateral to the side of the lesion, And there are signs of upper motor neuron lesion associated with spasticity, there is hypertonia, hyperreflexia, and positive Babinski sign. Intellectual impairment is rather uncommon in these patients, and 25% of the patients may suffer from seizures. Well, coming to spastic diplegia, there is weakness of both lower limbs. Weakness in the lower limbs is much more than in the upper limbs. Okay, there are signs of upper motor neuron lesion, like spasticity in the form of hypertonia, then hyperreflexia, and bilateral Babinski sign. Right. The lesion is secondary to the periventricular leukomalacia. That means white matter, descending white matter that lies in the periventricular area is subjected to ischemic injury, thereby resulting in periventricular leukomalacia and cyst formation. The seizures are uncommon, and there is no intellectual impairment in these babies. Okay, and adequate physiotherapy can improve the motility and motor dysfunction. Right. The next common thing is spastic quadriplegia. Spastic quadriplegia is the most severe form of cerebral palsy, okay, involving all the four limbs. All the four limbs are equally affected with spasticity, hyperreflexia, and hypertonia. There is intellectual impairment, okay, and swallowing difficulties, and patients suffer from recurrent aspiration pneumonias. This is because of the spasm of the oropharyngeal muscles, resulting in difficulty in swallowing because of pseudobulbar palsy. Okay, the lesion involves the corticobulbar fibers running from the cerebral cortex down to the motor nuclei of the brainstem. Okay, and seizures are more common, right? So that means child with spastic quadriplegia suffer from weakness of all the four limbs and complicated by seizures, intellectual impairment. Okay, and in course of time, they develop the contractures of the plexus of the knee. And ambulation is very difficult, right? And these are the children who suffer from severe mobility and motility. And these are the children difficult to manage. And there is a big, the dynamics of the family is so much disturbed. And there is a lot of economic burden and the healthcare cost for the parents who is having the child with spastic quadriplegia. And pathological lesion is the form of periventricular leukomalacia with multicystic, okay, diffuse cortical cystic leukomalacia. The other one is the dyskinetic. Dyskinetic cerebral palsy is rather less common, accounting about 5 to 6% of the patients with cerebral palsy. Dyskinetic cerebral palsy is again divided into two forms. One is the dystonic form and choreoathetotic form. Okay. In dystonic type cerebral palsy, there is an increased tone and reduced activity. And in choreoathetotic form, there is increased activity and decreased tone. The lesion involves the subcortical white matter and the basal ganglia. And premature infants who have the hyperbilirubinemia during the early neonatal period may suffer from this form of cerebral palsy. Okay? And in these patients, intellect is normal and there are no upper motor neuron signs. Okay? Supportive care, physical and drug therapy, and other modalities to control the involuntary movements may show some amount of functional improvement. The last one is the ataxic form of cerebral palsy. There is generalized hypotonia and incoordination and posture instability. The individual cannot maintain his stance and the gait is abnormal and he'll be so unstable while making the steps. And in these patients, intellect is normal. Okay, adequate supportive care and wheelchair assistance, etc., are required to improve the. That is, you cannot get the normal gait in these children. Gait is so unstable, you cannot maintain the posture or the balance. The lesion involves the cerebellum. Mixed form. And symptoms are not related to one type. One half of the body could be hypertonic, other half could be hypotonic. There could be involuntary movements involving one half of the body or one limb in this form of cerebral palsy. So when you look into the clinical features of cerebral palsy, there are children with the impaired intellectual function, and there are children with normal intellect. Okay. Most of the children, they'll have motor disability with hypertonia and hyperreflexia and involuntary movements. Okay. Only those children where there is extensive involvement of the cortical gray matter, as in the spastic quadriplegia, you will get the intellectual impairment. Okay. Rest of the forms, say it is hemiplegia or diplegia or extrapyramidal form of cerebral palsy or ataxic form of cerebral palsy, the intellectual development is normal. Okay. So it is very important to identify the clinical type of cerebral palsy with a thorough clinical examination, and in the light of the detailed history, will give you the clue related to the pathological lesion and the anatomical level of the injury. So these things are very important in making the diagnosis and the management of the child with cerebral palsy. So as I told you, detailed history is very important. Okay. Besides, complete neurological examination. Detailed history in the form of the antenatal history, natal and the birth history and postnatal history should be taken in detail. Okay. And the detailed developmental history. How is the baby soon after delivery? Is the baby floppy or is the baby stiff? Are there history of convulsions in the early neonatal period? Okay. Is the feeding is normal? Is the baby is showing normal crawling or crawling to the commando type of crawl? Or is the baby showing the hand preference? Okay. Whether the baby is picking the objects with one hand and the other hand is not moving the other hand. Okay. This history will tell you the part of the body that is affected. Okay. Right. And detailed clinical examination with regard to the presence of means status of the intellectual development and the presence of upper motor neuron signs and test for the coordination, okay, and look for the cerebral signs, etc. Followed by imaging, MRI signs of MRI may show the atrophy of the brain in one half of the brain in the case of spastic hemiplegia. And there could be periventricular leukomalacias or multicystic cortical leukomalacias, etc. Their genetic studies should be carried out in a suspected case of developmental abnormalities of the brain. And lab workup for comorbidities, presence of urinary tract infections, X-ray chest to know the recurrent pneumonias, etc. should be carried out in order to plan the treatment accordingly. Coming to the treatment of cerebral palsy. After treating the comorbidities, like anti-epileptic drugs to control the seizures, okay, especially children with the, say, spastic quadriplegia, they will have the drug-resistant refractory seizures. Then with regard to the treatment of the spasticity, other problems related to movement, posture, and the balance, we put the patient on physical therapy, drug treatment, some surgical interventions, and we are going to mention few current modalities for the treatment of cerebral palsy. Coming to physical therapy. The physical therapy is aimed at, improving the motor ability, improving the functional ability of the motor function, and reducing the development of contractures, okay? And the modalities include muscle stretching exercises, muscle strengthening exercises, resistive exercises. But the idea of giving the physiotherapy is to improve the strength of the muscles and the functional ability, but limited by fatigue and pain. Okay, you should not subject the child to pain. That is very important. And speech and language training, recreational therapy to improve the involving the child in the play activity, then occupational therapy and special education, the children with intellectual impairment. Drug therapy. Drug therapy is given to improve the range of movement of the spastic muscles. The drugs that are given are diazepam, dantrolene, and baclofen, which can be given orally. These drugs cause the hyperexcitability of the muscle, and because anti-Hahn cells are more excitable because of the loss of inhibition by the upper motor neurons or the anti-Hahn cells. So these drugs are going to dampen the hyperexcitability of the anti-Hahn cells, thereby causing the relaxation of the muscles, improving the range of movement. And intramuscular injection of botulinum, when the botulinum is given locally into the muscle, it causes the reduction of the spasm, improves the range of movement, and the functional ability of the muscle can be improved, and its effect lasts more than 3 months. It is a commonly used drug to reduce the spasticity and improve the motility of the limb. Intrathecal baclofen sodium is given in the form of pump, the form of infusion using the pump. The drug directly comes with the spinal cord, directly comes in contact with the spinal cord, thereby reducing the excitability of the anterior horn cells and the lower motor neurons, thereby resulting in the reduction in the spasm of the muscles, improving the range of movement. There are few surgical modalities for the management of children with spastic palsy, spastic cerebral palsy, because there is gait abnormalities related to the contractures and tendon lengthening procedures are going to help the child with the abnormal gait. Okay. Tendo Achilles lengthening procedures and the anatomies of the adductors of the hip are some of the procedures carried out with the gait abnormalities in this children with cerebral palsy. Posterior rhizotomies. Posterior rhizotomy, you are cutting the posterior root of the spinal nerve, thereby inhibiting the proprioceptive signals reaching the posterior horn cells, which in turn cause the excitation of the anterior horn cells. There is a continuous valley of afferent impulses from the muscle spindle to the posterior nerve root ganglion, because the cell bodies for the proprioception are the cell bodies for the sensory perception. They are located in the posterior nerve root ganglion. Okay, there is a continuous valley of impulses reaching the posterior nerve root ganglion from the muscle spindle, which in turn cause the stimulation of the anterior horn cells. Anterior horn cells become more excitable, thereby causing the hyperexcitability of the muscles. So posterior rhizotomy is going to inhibit the afferent proprioceptive signals reaching the anterior horn cells, thereby reducing the spasm of the or excitability of the muscles. But the problem related to the posterior rhizotomy is there will be loss of other sensory modalities. Though there is a partial improvement of the muscle motility of the movement of that particular muscle, there could be sensory disturbance related to the other modalities. Well, you have the children with the abnormal movements, like jerky, choric movements, which will be disturbing the child throughout the day. And there could be choreoathetoid movements with hypotonia, which will be very much disturbing to the child. But these children, intellectual function is normal. There are no signs of upper motor neurons. So see the situation. Child is conscious, aware of the things, what things are going on around. His intellectual capacity is normal, but he is disturbed by the continuous jerky, athetoid, choric form of movements. Okay. So these children should be managed with the drug treatment that control the involuntary movements, like the L-dopa, other dopamine drugs used in the Parkinson disease, and sometimes you may proceed with the deep brain stimulation to control the involuntary movements. Okay, these are the various modalities of the treatment that are given to the children with cerebral palsy to improve the functional disability in these children. There are certain current modalities like stem cell therapy, because stem cell therapy is going to regenerate the tissues which are damaged in the injury. This modality of treatment is going to help assist the children in few cases with cerebral palsy. The other modality is constant induced therapy. What is constant induced therapy? You restrict the movement of the normal limb. Okay, let the patient do all the activities, the movement with the involved or paralyzed limb. So this sort of training is going to help assist the regeneration of the injured neurons. This form of therapy is called neuroplasticity. Okay. Then functional electrical stimulation. Mild electrical stimulation of the involved limbs can improve the motor strength and the movement. Well, these are certain of the modalities involved in the treatment of cerebral palsy. Well, I tried to cover most of the aspects of the cerebral palsy. And thank you for your patient listening. And we'll meet you again in the next class. Until that time, thank you very much and bye-bye.